HIV. Early signs and symptoms. HIV is a virus that attacks the immune system. It can weaken immunity to the point where the body struggles to fight infections and disease. If a person receives treatment for HIV after early diagnosis, they are less likely to develop more severe complications. Early symptoms. A person should never rely on symptoms alone to tell whether they have HIV. The only way that a person can know for sure is to undergo testing. Early testing can help a person receive effective treatment and prevent transmission to other people. The symptoms of HIV vary among individuals. However, early stage symptoms typically include the following: fevers and chills, night sweats, muscle aches, rashes, a sore throat, general fatigue, swollen lymph nodes, mouth ulcers. Not everyone will experience these symptoms. How HIV affects the body. HIV attacks the immune system. It specifically attacks the CD4 cells, which are a subtype of a group of cells called T cells. T cells help the body fight off infections. Without treatment, HIV reduces the number of CD4 cells in the body, increasing a person's risk of getting infections. If HIV develops to stage 3, the person will also have a higher chance of developing cancer. Do signs differ for males and females? HIV infection is different between the sexes. According to the Office on Women's Health, some health issues including sexually transmitted infections or STIs and vaginal yeast infections are more common and more serious in females who have HIV. Stages. After the early stage of HIV infection, the virus moves into a stage called the clinical latency stage, which some people call chronic HIV. The virus is still active during this stage, but it reproduces at much lower rates in the body. During the clinical latency stage of HIV, a person may not have any symptoms. Some people who are not taking any medication to treat HIV may remain in this phase for 10 or more years. However, other people may progress past the latency stage more quickly. A person who receives antiretroviral treatment for HIV may stay in the clinical latency stage for several decades. During this stage, they are less likely to experience serious complications. When the levels of virus in the body are very low, it will not transmit to another person. Transmission. HIV is contagious and it can transmit from one person to another in several different ways. According to the CDC, the most common way of transmitting HIV is through sexual contact without a condom. The virus can also spread through the use of needles or syringes in intravenous drug use. People can catch HIV through contact with bodily fluids that contain the virus. The only bodily fluids that can transmit HIV are blood, semen, pre-ejaculate, rectal fluids, vaginal fluids, breast milk. HIV can transmit to another person when these fluids enter their bloodstream, either through an injection or by coming into contact with a mucous membrane or damaged tissue. Mucous membranes are present inside the rectum, vagina, penis and mouth. A woman can also transmit the condition to an infant during pregnancy. Although this is not always the case, many women who live with HIV can give birth to an infant without HIV if they receive the appropriate prenatal care and follow their treatment plan. The World Health Organization stated that without any medical involvement, transmission rates from woman to baby range from 15 to 45%. If a woman receives treatment during and after pregnancy, these rates can fall to below 5%. When is HIV contagious? In the early stage of HIV transmission, the levels of the virus in the blood and semen are high. A person can easily transmit the virus during this time, and transmission is more likely during this primary acute stage than during the following stage. During the clinical latency stage, a person living with HIV experiences fewer symptoms. However, they are still able to transmit the virus to another person. According to the CDC, a person with an undetectable viral load cannot transmit HIV to someone else. It is not possible because the HIV treatment suppresses the virus, leaving a low presence of HIV in the blood. When HIV is not detectable in a test, it is not transmissible. People with HIV who receive an early diagnosis have a good chance of receiving effective treatment. This treatment can help them stay healthy and maintain a good quality of life. Anyone who notices symptoms or believes that there is a chance that they may have HIV should ask about testing. With early testing and treatment, the outlook for many people with HIV is excellent.